Capsular tightness has limited your patient's ability to fully extend her knee. Treatment to restore joint motion. A. Anterior glide, external rotation of tibia. B. Anterior glide, internal rotation of tibia. C. Posterior glide, external rotation of tibia. D. Posterior glide, internal rotation of tibia. And the answer is option A. Anterior glide, external rotation of tibia. Explanation for this question is: anterior glide with external rotation of the tibia is a manual therapy technique used by physical therapists to help restore normal joint motion and improve range of motion in the knee. During this technique, the therapist applies pressure to the front of the tibia while rotating the lower leg outward, which helps to stretch the anterior capsule of the knee joint and restore normal joint mobility. It is important to follow the physician's recommendations and to ensure that this technique is performed correctly and safely, and that the appropriate amount of force and rotation is applied. Other techniques, such as stretching and strengthening exercises, may also be used in combination with manual therapy to help improve knee function and restore normal joint mobility.